Hello, my name is Jim. I'm with Team 7, and today we're going to be reviewing tracheostomy care for our patient. First of all, before we do any type of procedure, we want to make sure that we do have a doctor's order and that it should be part of our care plan. This is something that procedure should be done every day, and we should be teaching the patient or the patient's family and caregiver how to do the tracheostomy on a daily basis. Some of the equipment we'll need is, first of all, if you suspect the patient has any type of respiratory infection, then you should put your protective equipment on, such as a mask. But today I'm not going to use that because so you can hear me and be more understandable, or a isolation gown to protect yourself from any secretions or drainage that's from the tracheostomy. The other supplies that we should be having in the home is a source of oxygen, whether that's the patient is on oxygen, must be an ambu bag, or sometimes if they're on a positive ventilation. Otherwise, we're going to have the trach supplies that we need. We have the tracheostomy cleaning kit here, hydrogen peroxide, normal saline, extra cotton tip applicator, drainage sponge, suction catheter, and the trach tie. So first thing we're going to do is make sure we wash our hands and don our gloves and introduce ourselves to the patient as far as what we're going to be doing and what to expect from our procedure. It should not cause any pain or discomfort to the patient while we're doing this. And again, we should be demonstrating this to the patients and the family, the technique in doing tracheostomy care. So first we're going to assess the patient also, make sure what type of tracheostomy they have. It's either a metal type trach or the plastic type. In this case, this is a Shiley, or they can have the Portatec. And sometimes it can just be a stoma. That is, they just have an opening there, and they generally put a tracheostomy during the nighttime when the patient's asleep, and during the daytime the stoma is open, and in that case we're just cleaning the stoma site with saline and make sure there's no buildup of mucus or phlegm. So why are we doing tracheostomy care to begin with? Well, the tracheostomy site itself is not a sealed system, it's open, so every time the patient's coughing, he's producing phlegm or mucus, and that builds up around the trach site, and of course that can always be a source of infection. So we have to make sure that that is clean, and sometimes if the patient has heavy mucus production, a lot of coughing, then this process might have to be done more than once a day. The second point that I want to make is when we see the patient in their home, this is not a sterile technique, rather it is a aseptic or clean technique. However, and the reason is because the patient in the home has a disposable inner cannula. If the patient has a permanent inner cannula and we're cleaning that, then it's a sterile technique, because we need to make sure the sterility of the inner cannula when we're cleaning that. And as I said, the cleaning kit in the tracheostomy kit has all those necessary tools to clean the inner cannula. But at this point, most of our technique will be clean or aseptic. So we're going to be assessing the patients first of all. We're going to make sure that their breathing is nice and comfortable, no respiratory distress, and we're going to be listening to the breath sounds bilaterally, making sure that the patient is relatively clear. If there's a lot of coarse crackles and the patient needs suctioning, then we need to do that first. And so we have a suction catheter here, and again, we can just hook it up to the suction machine and suction the patient as we normally do. Okay, so, and again, a key point here is never place yourself in front of the patient, because anytime we're manipulating the trach or the inner cannula, that will induce a cough, and that will produce a mucus plug that's going to be flying in your way, and you want to avoid that. Again, you can don on some protective equipment if you feel that there's a lot of secretions or heavy production of mucus. So first thing we're going to do is we're going to open our tracheostomy kit here, cleaning kit. And as you can see, there's two compartments. One has the smaller compartment with the sterile drape, and then the other side will have the sterile gloves and the rest of the cleaning kit. So we're going to take our drape here and create a sterile field for us to use. And as I said, we don't really need a sterile technique, but we need to keep this area nice and clean so we don't introduce any organism or bugs to the patient. Yeah, it's almost close. Okay, so we're going to drop everything in here, in our field there. Like so. On the larger compartment, we're going to be pouring our hydrogen peroxide, about 1/2 inch to 1 inch. And then we're going to follow that with normal saline, diluting it to half strength, about 1/2 inch to 1 inch. And then on a smaller compartment, we're just going to pour saline. Okay, put that away. Now I'm going to go to my patient and I'm going to remove the drain sponge that's here. I'm going to remove that, dispose of that. Okay. Now I'm going to be changing my gloves at this point. Clean my hand. So now I'm going to be putting on my sterile gloves. Okay. So we got our sterile gloves on. So what I'm going to do now is I'm going to clean the tracheostomy site itself. If the tracheostomy is a new trach site, and I'm saying that if it's 10 days or less, we need to clean it with saline only. If it's an old trach site, and most of our patients will be, in fact, it'll be an old trach site because they've been in a nursing home, they've been recuperating. We can use the hydrogen peroxide, half-strength hydrogen peroxide to clean the site. And how we do that is dip the cotton tip applicator, and we're going to clean top to bottom. Make sure that we're removing any secretions or phlegms. And while we're doing that, we're also going to be observing, making sure that there's no redness, tenderness, or any unusual odor that we see at the trach site itself. And also make sure that you clean the bottom part of the trach site, because that's usually not easily visible, and we'll make sure that that's very clean as well. After you clean it with the hydrogen peroxide, we now will rinse that with the normal saline. Again, dipping the cotton tip applicator and rinsing it off with the saline, same way we cleaned it. We want to make sure that the trach site itself is dry, and you can use the sponge that's provided for you and gently insert it inside there to make sure that we are cleaning it's drying, and including the bottom part of the flange of the tracheostomy. Make sure it's dry. Okay, so we've done that. So if you look back here, these are the brush that is used for actually cleaning or scrubbing the inner cannula. But these days we really don't do that anymore, since most of our patients will have disposable inner cannula, and as I said, we don't need to do that. And so this is the cleaner, and this is a pipe cleaner. You actually insert this inside the inner cannula to make sure that it's dry and not moist before you put it back into the patient. So we essentially really won't be using this at this point. At this point, we finished cleaning the tracheostomy site, so now it's time to change the tracheostomy tie. And usually it's done once a day, or if the trach tie is soiled or has moisture and what have you. The cleaning kit actually comes with this trach tie, and for those of us that's been around the block a few times, as you can see, this is actually a dental floss. So we've been securing our trach ties with the dental floss all these years. So we're not using this anymore. We disposed of that, and instead we now have our modern or more comfortable trach ties. As you can see, it's very it has foam and secured by Velcro, and it's much more comfortable for the patient. Okay, so we're going to be replacing the trach tie at this point. So first of all, I'm going to insert the trach tie behind the patient. Okay, now we're going to be removing the existing trach tie. Now, I'm not suggesting that you guys do this, because kind of keep in mind that anytime you manipulate the trach or the inner cannula, that can cause the patient to cough. So we have to make sure that the tracheostomy is secured all the time. You can ask a family member to assist you in this process. And as I said, I don't encourage this with all you nurses, but in my case, my particular case, I was fortunate enough to be born with a third arm. So what I do is I secure the trach tie with or tracheostomy itself with my third hand. As you can see, make sure that that thing is secure there. Now I can use my other two hands to slowly and gently remove the existing tracheostomy. Okay, remove it on both sides, like so. And we now remove this. Now we're going to put the new trach tie, and it's going to go right inside the eyelet here. And if I can demonstrate, I'm going to remove my middle finger out of the way. Okay, and insert this like so. Okay, like that. Let me demonstrate that again. For those of you who didn't see, lift up the middle finger here, get it out of the way, and I'm going to insert this trach tie and secure it with the Velcro like so. And then I'm going to do the same thing on the other side. Oops, there goes my head. Okay, what you want to do is you want to make sure that the trach tie is snug, not tight. So after you put it on, you must be able to put a finger or so inside there so that the patient is comfortable with that trach tie. Okay, so that now our tracheostomy is secured, it's not going to go anywhere. Okay, at this point, we're going to go ahead and put the trach sponge on. And as you can see, these are already pre-cut. Some people will actually take a regular 4x4 and cut it, but I don't like that because there's some sediments that can actually go into the tracheostomy. So what we have in the agency are these pre-cut drain sponge that the patient should have in their home. Okay. At this point, we're going to be replacing the tracheostomy sponge, and we're very easy to do. We're just going to insert it underneath and slide it on top, like so. A little bit difficult with the mannequin, but we want to make sure that that sponge is nice and tight right there. There's no kinks or like so. Now the patient should have some extra supplies of drain sponge in their home, and because depending on the secretions that they produce, this might have to be changed several times during the day. So after we replace the tracheostomy sponge, we can now replace the inner cannula. And as I said earlier, these are all disposable, so it's a one-time use. And the inner cannula is sterile, so we need to keep a sterile field as far as when we're replacing that. And we have here our disposable inner cannula. And we just open that. And we're going to slowly remove the inner cannula from the trach, and it's clipped on there, so you just push on this and then pull it out slowly. And again, when I pull it out, I want to observe the inner cannula for any foul odor or any unusual coloration, or that could be an indication that there is a respiratory infection going on. So I will also dispose of this. And my inner cannula, I'm just going to make sure that I just hold the end of it. And again, there's a clip. So slowly, I'm also going to be looking at this, the tracheostomy itself. Make sure it's clean and there's no sediments or any kind of unusual mucus in there. And slowly just put it in there. And again, this just clips on to the tracheostomy itself. So we finished with the tracheostomy care, and at this point we just need to document as far as what we done, the tracheostomy care, and if we were actually instructing the family or the patient how to do the procedure and how they did, and if in fact they are independent. If there is any type of unusual findings such as redness, tenderness, or color, we do need to notify the doctor and possibly CNS so we can treat that early. That concludes our demonstration with the tracheostomy care. Again, my name is Jim. Thank you for watching this video. Until next time, bye-bye.
I'm Becky. I'm your nurse today.
Hi, Becky. Nice to meet you.
Nice to see you. Can I get a chair to pull up and get next to you?
Please, get comfortable.
Okay.
Oh, you're going on this side of me? Okay.
Sure. So how are you feeling today?
I feel really good.
Okay, good.
You having a good day?
I am. I'm going to start setting things up because the first thing I want to do with you today is take your vital signs.
Okay.
So I'm going to turn on my computer, let that warm up for a second.
Need me to push my shirt up?
Sure, you can get that ready while I wash my hands rather quickly. And then I'm going to set up a little thing to take your blood pressure, see how things are going with you.
Got a big glove. There you go.
Ah, thank you. How have you been doing? Have you been taking all your medications as prescribed?
Pretty much so. Okay. So.
You've been feeling okay?
Pretty good.
Any shortness of breath or pain anywhere?
Sometimes I have the shortness of breath.
Okay. Do you have any medicines that help you through that part?
I do.
Okay.
I have an inhaler.
Does it help you in that part of it?
Yes.
Okay.
You tell her about the pain in your foot too, honey.
Oh, I will.
How
I
your
will.
toes lock up on you.
Okay. So let me just put in my password here. While this warms up, we're going to go ahead and start taking your vital signs.
Okay.
Okay. Any kind of new issues you want to bring to my attention?
No, I've been feeling really good.
Okay. Let me go ahead and clean this off with my alcohol.
Okay.
Okay. Do you know where your blood pressure usually runs?
It's been fluctuating a lot, so I've been on some new medication.
Oh, new medication. Okay. Give me 1 second here. Okay. It looks like it's 110/64, and that's in a normal range, so good
That's
job on
pretty
that.
good. My new medicine's working, I guess.
Good job.
I'll have to let the doctor know, because
Yeah.
he took me off one.
Okay, I'm going to listen to your heartbeat for just a second. You have a nice regular heartbeat. That's really good.
That's always good.
Yeah, and in a normal range, it's 72. Okay, go ahead and take a deep breath for me. And exhale. Good job. Nice and clear so far. Very nice. Okay, just sit forward, and I'm just going to lift your shirt
Okay.
and make sure your skin is nice and clean. Very good. No pressure sores noted. Another deep breath. Now I'm hearing a little bit of congestion in your lungs. Have you had a wet cough or anything like that?
No,
Okay.
I don't think so. Have I, Dan?
At night she coughs.
Okay. Go ahead and take one more deep breath. Perfect.
I'm very dry at night, so sometimes it'll make my mouth is real dry and I'll cough.
Okay, I'm just entering your vital signs here, and I see on the computer that your vital signs have been fluctuating. You've had a low blood pressure here, 70/40, and then at our other visit, we had 120/60, and then you fluctuated down. Do you take any kind of medication for that would help with your blood pressure?
I do take a blood pressure medicine.
Okay, I see it's right here, lisinopril, and it's supposed to be taken every 12 hours. Do you know if you separate it every 12 hours?
I do. I take it at night.
Okay, so what I
So
want you
maybe
to...
it's too long a stretch, huh?
Well, it's supposed to be every 12 hours. So the way I want you to think about taking that medication is if you're going to take it at 8 o'clock in the morning, I want you to take it at 8 o'clock at night.
Oh, okay.
Now, I see you're visibly short of breath. I'd like to take your oxygen reading, but let me check here on the computer. Let me pull it up to see if your doctor, we have an order from your doctor that says we can go ahead and do that.
Okay.
And I don't have one here, so I just have to make a quick telephone call to
Okay.
him and give him a call. And actually, while I am calling him, I would like to see if I could set you up on a home monitoring system called our telehealth. And what that does is the graph that I'm showing you on the computer, the next time I come out here, we'll get your readings every day because you have a diagnosis of COPD. It's important to get your daily weights, your daily heart rate, and your oxygenation status to see if your medicines and your disease are working well together. So I'm going to go ahead and call Dr. Smith right now and get that order.
Can Dan look at this system that they're going to be setting up?
These are her vital signs.
Those are my vitals, and
Hi,
it'll
may I speak to
show
Dr.
Very
Smith?
impressive, huh?
every day.
Great. Hi, I'm here with Vi Walsh. Date of birth is 4/6/42.
42.
And I'm calling to get an order to check the patient's pulse ox. Yes, and we'd like to offer the patient a home health monitoring system that is no charge to the patient while she's on service with us. But this will allow us to get her daily weights, blood pressure, and pulse ox on a day-to-day basis, and we'll only notify the doctor if it's abnormal and her medications are not working. Okay, great. I'll put that down as a verbal order. Thank you. So I'll go ahead and in my computer, open up the problem and actually get that order in here so everybody knows you're on that.
Awesome.
Okay.
So she used her sleep machine at night?
A sleep machine.
Yeah. What do they call it?
My, what do they call those things you put on your
Is
face?
it like a mask?
Yes.
To help you breathe,
Oh,
correct?
a CPAP.
Oh, yeah, the CPAP.
Yeah.
Okay, I don't even see that listed that we have that in the computer. I'm gonna have to see the machine in just a minute so I can get the correct settings.
Okay.
And probably, looks like your DME company is Apria. So I'll call them to verify the settings that are on the
Okay.
CPAP, as
That
well
sounds
as
good.
put that in here. And you don't use that at night?
Not like I'm supposed to.
No, she doesn't until I wake her up, tell her to put it on.
Okay, well that CPAP machine is really important. That might be the reason you have some of that congestion and rails in your lungs, is because it forces the air and opens up the lungs. So when you're sleeping, you're actually getting the oxygenation you need.
Oh.
It's so important, and that's why we need to start those daily.
I guess,
Does that make her snore also if she doesn't take it?
No, it'll prevent her snoring, so it's actually a good thing. So I will call Apria when I'm done and just verify your settings are correct.
okay.
And I now have an order to check your oxygenation, so we'll go ahead and do that as well.
Okay.
Now, do you have anything else? I don't have anything listed on the computer in your medications about the breathing treatment you were talking about. Now, is that a
I haven't.
machine or?
I have an inhaler.
Okay. Last time we didn't see an inhaler on there, so when we're all done with this, and I'll have you just write, you'll get a better reading if you
Okay.
put it here. I'd like to see that the inhaler from you and any other kind of meds that you might have, anything that you buy at CVS that you may not be taking now, but you take maybe when you have a headache. And I don't see vitamins listed on the computer either, and most people take like a daily vitamin or
I don't.
supplements. Okay.
Is that
So-
real?
Yeah, that's real. Your oxygenation is 92 and your pulse is 68. So it's within normal limits and
Is
it's
it?
right
Oh,
where it's
good.
supposed to be. So good
Good.
job on that.
Good.
She's normal?
So can you go ahead and get the inhaler?
Sure.
And can you guys think of any other medications that I don't have listed on here?
I have an Advair that I
Okay.
use. And my messy purse here.
That's okay. I will go ahead and add this on the
The sea
computer.
bag.
My sea bag.
And do you take this
I
once
have-
a day?
Twice a day.
Twice a day.
Kind of sloppy with it though.
Okay. It's so important to clear out those
I know.
lungs for you. I'll take that other one. Okay. And how many times a day do you take this medication?
I don't take that unless I need it,
Okay.
which is probably,
Right now, right?
Inhale 1 puff by mouth 4 times daily as needed.
Okay.
So,
So since you're a little short of breath right now, I'd love for you to show me how you go ahead and take this medication.
make them.
Yeah.
Okay. Shake it really good. Have to take a deep breath.
Very good.
Good.
And when was the last time you took this? Did you take it already this morning?
No,
Okay.
I
'Cause
didn't.
we should probably do that too, since it's time.
Okay, I can do this real.
Okay.
Okay. There we go.
Excellent.
Is
And
that good?
You did great. And I'm just
I
gonna
need to have a little water. 'cause it's
exactly.
supposed to
That was my
It's
next.
supposed to be.
Yeah, you want to
Rinse.
clear it out. If you don't, you can get infections and. Okay, so I am just actually quickly going to chart down that you did a correct return demonstration for your
Oh,
inhalers.
good.
So I'm just going to put that on your chart, so if the doctor ever wants to know, we can say that we observed you doing your inhalers correctly. Now the key is once we usually get this home monitoring system, which someone will explain to you, set up in the house, we usually only need to see you once a week because we monitor you on a daily basis. But I know that we have a little lack of information that we need to share with you regarding your disease process.
Okay.
So I'm going to share with you, which I did bring in because I did know you had the COPD, is our COPD packet.
Oh, okay.
This is a great tool for learning. If I can go ahead and get it open.
There you go.
There's some important information on here and I'd like to share with you. And one of it being is the chronic obstructive zones. These are really important. The green is always where you want to be. And yellow is a warning sign. And I'm going to fill in these doctors' numbers and go over it a little bit further. But red is a 911 phone call. And these are all signs that your symptom is having a flare-up when you're in here. So if you have an increased amount of sputum, if you have increased cough or wheezing even when you take your medicine, or an increased number of quick relief medicines. Your quick relief could be your inhaler that you use when you're just short of breath.
Right.
So like right now, how are you feeling after doing that?
I feel good.
You feel a lot
open.
better?
Yeah.
Okay, so that's a good sign.
Right.
We need to avoid your hospitalization. Okay?
Right.
These COPD can get you in the hospital and out of the hospital on a regular basis. Our job in home health is to prevent you from going back in. So we want to keep you always in this green zone. So we'll need your daily dry weight. And what that means is first thing when you wake up and you use the restroom, jump on your scale. And we'll provide one for you with this home health monitoring system.
Okay.
And then we'll want you to do your O2 sat. And then we'll write that down as your baseline.
What is the O2? Is that?
That's
the,
this monitor right here.
That we. Oh, okay.
Correct.
Okay.
And I'm giving your medicine a few minutes to work, and we'll see if we got that 92 up to a higher level.
Oh, okay.
So we'll go ahead and check that out right now. Okay, and then go ahead and put that there.
Will
So,
this clear?
mm-hmm.
Oh, okay.
So the yellow zone is where you want to make a phone call to us or your respiratory therapist or your doctor.
Oh.
Okay? So if it's during the day, we like a phone call to us because sometimes we can come out and listen to your lungs, troubleshoot with you. If your O2 sat is down and your meds aren't resolved, we'll have an alert. Okay? If you're ever short of breath, you can use this again and it will notify us that you're having some problems or call in.
Oh,
okay?
wow. Okay.
Do you know how to get a hold of our agency?
Yes, we have the phone number.
Okay, and it's also right here.
Oh,
I
good.
always tell people, put this on your refrigerator. Sometimes you don't feel good, you're sleeping with more pillows, whatever it can be, a weight gain, a small fever. These are all little signs you need to notify us. Now look at this. Your
Oh.
oxygenation went up to 94 from 92.
It did go up. That's awesome.
So that just proves your inhaler's working for you right now.
Great.
And red zone, is that what you call on the board? Mortuary?
Yeah, no, red zone
Oh,
is...
not ask.
You know, I married a comedian years ago.
The red zone is we need to see you now or it's a 911 emergency room visit. We want to avoid this altogether, so let's pay close attention. I'm going to give you guys a little homework. Let's read pages 1 through 4 and our visit tomorrow, we're going to follow up on that. And if you have any questions, we'll go over it at that time, okay?
Sounds great.
So I'm going to add a couple more visits to see you. Now your husband said something about foot pain in your feet.
My toes are kind of, they lock up on me sometimes, just out of the blue, and I
They
have
like
to,
crossover.
and they hurt. But they hurt even worse when they release.
Okay, so I'm going to start to take off your shoe, and I just need to know real fast if you're a diabetic.
No, I'm not.
Okay, I didn't have it on your
No.
your sheets, but
Do you need
it's
this?
a good thing to know.
No.
Oh, I'm so sorry.
Scratch.
Let me take that for you as I get my gloves. So I'm going to take off your shoes, and I'm going to look in between your feet and toes and make sure that there's no sores. And then tell me a little bit more about your pain. On a scale of 0 being no pain at all, and 10 is like being run over by a truck.
When it happens,
Where do you rate your pain right now?
oh, I'm fine right now. I'm
Do
1.
zero-
Yeah,
a 1 out of
0.
10.
Yeah.
Now, do you take any medications to help you relieve the pain in your feet?
No. Twist, and then they stay that way for a while, and there's really not much you can do, and then it'll finally relax. Hurts really bad, and then it just
How
eventually
bad on that
releases.
scale?
Oh,
of 1
I'd
to
give it a
10?
10.
A 10, okay.
And then, but there's like, don't touch it, leave it alone, and then it'll release. But it's like at a 10 for a little while, and then it's gone.
Do you take any medications
For
while
that,
happens?
no.
Okay, so you have a 10 out of 10.
It's kind of a
pain?
short, you know, it just
Short.
happens,
Okay,
and then once it's done, it's done.
okay. Tell me a little bit about your diet.
Well, I don't know, probably don't eat the right things, or,
Okay, are you
Right.
eating 3 meals a day?
yeah, or sometimes just 2. If
Okay.
we eat late in the morning, then I'll just eat dinner.
Okay. And then are you snacking throughout the day?
Not like I used to. I used to be a grazer, but I'm not so much anymore.
And what would be a typical diet for you during the day?
This morning we had some waffles, or it could be an English muffin.
Okay.
Sometimes an egg.
Mm-hmm.
If I get hungry, maybe a half sandwich for lunch.
And what kind of sandwich would you have? Would you have lunch meat on that sandwich?
Yeah. Or it could
Okay.
be tuna.
Okay.
I like tuna with crackers.
Okay.
And then we usually always have a good dinner with vegetables and a
Vegetables.
potato and meat.
Fresh, or is this something you're cooking or something you're reheating in a microwave?
No, we're cooking,
Okay.
because we still have a full family at home. So
Okay.
we cook like fresh potatoes and vegetables and meat.
The next couple questions are going to give me an idea about your electrolyte imbalance and hydration. So what color would you say your urine is on a day-to-day basis?
Pretty clear.
And today, this morning?
Clear
Okay. And your last bowel movement?
this morning.
Okay. And was it normal for you?
Yes.
Okay. Give you any numbness and tingling in your toes ever?
No,
Sharp pains?
just when they lock up.
Okay, so other than when they lock up, which is a 10 out of 10 pain, I'm going to have to notify your doctor about that because that's way out of the normal.
Yeah, when it happens, it hurts.
Okay, so
It hurts.
I keep telling her I'll step on him and break a loose for you, honey. but
do
she
you
won't let me.
see do you
It's so
see a
good to me.
podiatrist at all?
No.
No. And have you ever told your doctor about this pain?
I have told him, but it doesn't happen like that often, or,
Okay.
and sometimes, you know, I could be wiggling my toes like this and it'll happen.
Okay. And have you ever had any other pain similar to that anywhere else in your body?
No.
Okay. So I will notify your doctor about that. When it happens, you say the pain lasts about how long?
Could be a couple of minutes, it'll stay locked up, but then afterwards it'll be another couple of minutes of just, I would say sometimes the pain's worse after it unlocks.
Okay.
So maybe the pain's an 8 when it locks and a 10 when it unlocks. It's almost like this horrendous bruise.
And then how long does it last about an 8?
Just another couple of minutes and it's
Okay.
gone.
So I'm writing all this down in your chart, and currently your pain is 0 out of 10. The worst in the last 24 hours is 10 out of 10 with the toes.
If it happens with the
If
toes,
it happens. Did it
yes.
happen last night?
No.
Okay. When was the last time it did happen?
Oh, I'm gonna say a week or so ago.
Okay.
It's
I'm
not,
still going to let the doctor know
Okay.
because this is new and abnormal for you and they're not aware of it.
okay,
So he might refer you to another physician or want you to come in and see him.
okay,
Okay? So I'm going to listen to the bowel sounds.
okay.
Okay? So I'm just going to lift up your shirt
My tummy.
and listen to your tummy. And then I'm going to pull your pant down right here just so I can get right on your skin. And you've got great bowel sounds, which
Okay.
I thought you would because you have daily bowel movements. Okay, do you wear glasses at all?
No,
Oh, okay. Let me just check the rest of your arms. This is the first time I've seen you, and in your chart it says that you don't get up and walk around that often. So we'll go into a separate room and I'll check your behind just to make sure you don't have any bed sores or anything like
Okay.
that. And I would like to add a couple more visits onto you to educate you further about your disease process. You know, we really should be avoiding lunch meats that are high sodium. Maybe we can
Right.
choose better choices at lunch. And then I will follow up with your doctor regarding your pain. And we'll see you tomorrow.
sounds great, Becky.
Okay, it was so
Yeah,
nice to
me
meet
too.
you.
Thank you so much.
Thank you.
Pleasure to
You
meet
have a great day.
Yeah, see you.
Good afternoon, it's 4:18. I'm Sharon Fredericks. I'm the Director of CMS for Home Health. First of all, I want to say thank you to all the actors, actresses, our stand-ins, family members that have been truly family members that have come in and taken part in the last couple videos. Hopefully this will be a good learning experience for you because we really did try to pretend we were in the home and acted out scenarios. However, there's a part of acting that the system is now starting, and it's called Aid It. And I'd like to talk about that because it's more than just movies of how we present perfect care and take care of our patients. The letters are A-I-D-E-T, and they stand for acknowledge, greet, talk to your patient, extend eye contact. And I'm doing that because I have several of my movie stars here in the room. Also, introduce yourself, where you're from, your name, your discipline, what you're going to do that day, and the duration of how long you're going to do there. And as you explain how long you're going to be there, that's the D. So I have acknowledged, introduced, duration, length of time in the home, and I'm going to explain to you what we are going to do today. If you watched the previous video, Becky did a great job because she explained everything, talking to the patient, all of that stuff, introducing herself, as did Jim on his trach care. But they also were opening up their computers, getting some of their stuff ready in the home, but still making that eye contact with the patient, family member, or whatever. And the T for Aid It, A-I-D-E-T, is thank you. At the end of a treatment, at the end before you leave, thank the patient, the family, whoever's in the home, and ask them if there is anything else that you can do to make them comfortable. It's all part of acting. Now, there's a little bit more because the hospital over at St. Joseph is beginning just talking about touching the patient as they say thank you. So that some patients, there's a barrier there, a boundary, they don't want to be touched. But if you think about the touch, that's also a healing touch. So extend a part of yourself during this Aid It, of acknowledging the patient, introducing yourself, duration of how long you're going to be with them that day, setting the tone for that, introducing yourself, and as you say thank you, shake their hands, somehow touch them, whatever is appropriate for the situation. Okay? Thanks. Enjoy the movies. Okay.
Mrs. Dunn.
Yeah, hi.
Wonderful to meet you. Hello, hello.
Hi. Just having a little trouble here.
Wow.
I just delivered this, and it's
You
just
just
getting
got out of
in
the
my
hospital.
way.
I think you're going to trip on something, aren't you?
No, I'm not. Fine, I'm fine. Just kicking
Well,
away
can I
my
put my things down over here?
Sure,
All right.
sure. No
Let's
problem
get going
here.
here. So how have you been doing since you got out of the hospital?
Oh, trouble breathing, pneumonia and all that, but, I think, we sent this out, and I'm, get through trouble getting used to it, but I think it's just going to be fine.
Okay.
Yeah.
Well, I have my handbook, and we'll get you set up with home health.
Oh, okay.
All right, so we're going to set you up with home health today.
Okay.
And, get you started with our start of care visit.
Right.
I should be here for about an hour, hour and a half
Okay.
to kind of go over some things with you and so forth.
Yeah.
Yeah. So,
Don't trip over that. Come on, watch
yeah,
your
we've
feet.
got
Come on,
to take
watch
care of
your
you.
feet.
Now, it's kind of dangerous with this. You might trip and fall,
Oh,
they
they
Yeah.
said that.
Yeah, so I see
Yeah.
you have a cane
Yeah, I
here.
do.
So you want to be careful with where you place this.
Yeah,
And how you
I'm trying.
No, it's very difficult.
Heather, stop that.
Do you have somebody back there?
Yeah, Heather,
Oh,
stop pulling
What's
it.
going on with her? Is she?
Well, I'm just babysitting. Her
Yeah.
mom just, had to go to work, so I'm babysitting.
Well, that's all right.
I'm gonna start babysitting with my oxygen and everything, but I'm babysitting. But
Okay.
Heather, will you please stop pulling my... Heather, oh my God, don't touch
Okay.
those dials.
That would not
Grandma
be a good
needs her
thing.
oxygen.
Yeah.
Heather, please. Oh my God, will you talk to her?
Um,
Please.
Well, the nurse has to tell you that you probably shouldn't be touching those dials. Is that okay? If your grandma says don't touch, then we don't want to touch those things, all right? Because that wouldn't be good for grandma. You know what you could do is put a cup over the dials and just kind of hold it in place, tape it around there.
really?
Like one of those styrofoam cups. That way she can't touch the dials.
It'll be a barrier for her, because that would be dangerous if she's changing your dials. You won't be able to breathe too well.
Well, she won't be here every day.
It still might be a good idea
Okay,
for you, because you shouldn't
okay.
be changing the dials anyway yourself.
Yeah.
Yeah, whatever the doctor ordered, you have to stick with that.
Okay.
So, do you have a sign up in your door?
No, they gave
for
me
the
one,
oxygen?
but they gave me one here, but I don't know. I don't know. I'm
Probably
really
wanna
I really
place
need to
that
do that.
somewhere. Yeah, where would you like to place that?
I'll put it in the window.
Is that okay with you to have it in the window?
sure,
Your neighbors know
sure.
that you're kind of ill?
Yeah,
There's
oh,
some
they
other
all,
alternatives.
They
You
see
can-
me limping around. They don't
Okay,
care. I don't care.
then we can put it in the door.
Yeah,
We'll do
okay.
that.
Okay.
If you didn't want them to know, you could put it right as somebody comes in to just alert them. Do you know why that you would put the sign up for oxygen?
Not really.
It's just, it says here, oxygen in use, no smoking. So we want to make sure that people don't endanger you by coming in smoking.
Oh.
And any other things where you might be exposed to flames, say like a gas stove or anything like that.
Uh-oh.
You wouldn't want to be at a gas stove with your oxygen going.
Oh.
Do you have a
okay.
gas stove?
Well, yeah, I was just gonna make some lunch.
Yeah,
Yeah, I got my soup here.
yeah. You wouldn't want to have your oxygen going while you're
what
making
am I
the
gonna do?
soup.
Just take
Do
it
you have
off
a
for a
microwave?
minute?
Do you have a microwave?
Yeah, I do.
Well, that might just be the thing. So this is
That's
kind of
terrific.
important, the no smoking, the no
Okay.
flammable things. Yeah, so
Okay.
I'll just put that in the window, okay?
Okay. All right.
Like here's okay?
Yeah, that'd be great.
Perfect.
Now you came a little early. Do you mind if I finish putting my face on
Oh,
here?
good, yeah, that'd be great.
Yeah. Let me just.
Are you using Vaseline-based lipstick
Oh yeah, I use it
there?
all the time. It's all
I gotta
dry.
tell you something. When you're having oxygen,
Yeah.
and there's a risk for burns if you're wearing petroleum or anything
uh,
oil-based. And I just heard a scary
Are you
story.
telling me I can't use my
Well,
my stuff?
there was a nurse that worked in a burn unit, and she found people with flash burns because they used an oil-based product and somehow got around a spark, and they burned their lips. Your lips would go first.
What I'm going to use makes
So
me
you would
pretty.
want to use, there's some items available that aren't oil-based, and that's what you want to look for when you're getting your
So I have to have my daughter look
cosmetics.
for those
Something that's not oil-based.
because that was I got to look.
You gotta look pretty.
I
It's
gotta
very
look good.
important.
I got good.
I
You know,
understand.
and somebody said really should tell the fire department. to have
That's a great
oxygen.
idea. Yes.
Yeah.
We can make that phone call
Yeah.
with you.
Okay, because
It's just a safety thing.
I gotta have my lipstick because when those guys come, every time
That's
I fall, they
right.
come. They send 5 or 6,
Yeah.
and they're all so good looking.
We'll,
It's the
we'll
only
make sure
time
we
I
call for
It's the
you.
only time I see a good looking man is when I fall
We'll
and those
just make
firemen
sure
come.
we call for you.
Okay, so I need to look good.
Yeah, we'll let
All
them
right.
know that you're here.
Okay, I tell my
Okay.
daughter to get something that's,
That's
not petroleum
Oil-based,
Oil-
like petroleum in it. anything
petroleum
with-
based.
Yeah, nothing with oil.
Nothing like that.
Because oil is flammable.
Okay.
Yeah,
So-
like your gas stove is
Oh.
flammable.
Hmm. Well,
There's some other flammable things.
oh my
to be
goodness, should I
alert
get
for.
this off right now? You got a tissue? Can I get this off right now?
Oh, yes.
So-
we'll get that.
You have a tissue?
Yeah.
Oh my goodness.
There you go.
Oh my goodness. Oh my God! There's a cockroach. Oh, jeez. Oh, I can't stand it when these things just come around. Man.
Hold on one second. We were talking about flammable things.
Yeah, yeah.
Yeah, so this is,
Oh, wow,
wait, let's
wow.
take a look. I think I can get it.
Okay.
You know, it looks like it was just a piece of dog food.
Oh.
So we're okay.
Oh.
We're okay. It's
I
not
don't
a
have to use
cockroach.
my bug spray?
And you know what? This is one of those flammable things we were talking about earlier to be careful for.
Well-
if you read the
Well, I
ingredients,
hope you're
it
going to
says,
bring me some
"Do not-"
information about all this
Yeah,
stuff.
so you gotta be careful.
I just
with
got
flammable.
home.
Yeah, the oxygen is kind of.
Oh my God.
There's in our little packet here I was going to give you, it's our patient handbook. And in it, there's an area about safety. So I can show you these things to help you remember what to do and what not to do.
I'm just getting so nervous here. I just got to have cigarettes. I hope you don't mind.
Okay, do you remember the sign, ma'am?
Yeah.
Mrs. Dundeer?
Yeah.
Remember the sign? It showed the cigarette with no
Oh,
smoking?
would that mean for me too?
I guess it does. Because you know the oxygen is right here.
You tell me I can't have my cigarette.
You know, fire and oxygen don't mix.
Well,
So
Yeah.
if you have to smoke, the recommendation would be to take off your oxygen, and if you can get outside, But you've got to be far away from the oxygen when you light up.
Well, I can't walk that far. I'm on a cane.
Have you ever considered another alternative to smoking?
What?
Quitting smoking, maybe?
I've been smoking for 70 years.
There are helps available. Have you spoken to your doctor about wanting to quit,
Well,
maybe?
he keeps telling me I ought to quit. That's not really a good idea.
We might have to make some phone calls and try to get you some help.
Well, okay. So you tell me you don't want me to smoke a cigarette right
I
now?
don't think you want to smoke with the oxygen going.
Okay.
Because you know what can happen.
All right.
Your face could become...
Oh my.
Yeah, we don't want that, do we?
Oh, that would not be good.
No, you wouldn't be beautiful and the firemen would be scared to look at you.
Oh, I can't have that.
No. So that's... you got to be careful. Okay? So
don't-
be very
okay.
careful with smoking with the oxygen.
Okay, so I go outside,
Anything but
Do
get away...
something, get
turn
a-
the oxygen off
turn it off.
before you go smoke. Because
Okay.
you-
Okay.
Flames and oxygen, they're like...
I don't know.
They just flame up and that...
Well, I'm
just
so
remember
sorry,
your
hon.
face. Remember your face of those firemen.
Yeah.
All right?
Yeah.
And you don't want to look like a brown prune with no
need
eyelashes.
to look good for them. Need to
No
look good for them.
eyelashes, okay? So here are some
Thank
ideas.
you so
You're welcome.
much.
We gotta have you beautiful. We
Oh,
want to keep you beautiful.
Gosh, look at everything I'm doing wrong.
Well, we're working on it together. It's only your
This
first
is
visit,
gr-
okay?
You've only been here 10 minutes. Look how much you taught me, young lady.
Okay. Well, we're
Oh,
trying to work
my.
with you.
This
All right.
home
So
health
we've
is
got
just
oxygen
wonderful.
safety. Now I don't know. Here's the first thing says what?
Oh, do not smoke. Oh,
Do
yeah.
not smoke or allow
number one.
any kind of smoking near you. How about number 2?
Okay. Well,
Stay away from open flames.
so my cooking. I gotta watch
So
my
that's the
cooking.
cooking, yeah.
Use my microwave.
That's
okay.
it.
All right. Okay.
Place a sign on the door or a visible area.
Well, we just did that.
Yep. Post the
Okay.
signs. Do
Yeah.
not use flammable products like aerosol sprays. That would have been that.
Okay. Well, I
Okay, paint thinners,
gasoline. So it's really,
oil-based
so
lubricants.
it's really just my bugs and my cockroaches I gotta worry about. That's all.
I don't know. Do you use sprays to make your place smell nice, or do
Oh
you
no
use,
no no no! I don't like those.
Do you use candles?
No, I don't like
Okay,
those.
that
I
would
don't
be
like those.
too
No,
much flammable. Okay, and here's your number 7. Do not use oil-based, petroleum-based cosmetics.
Even lotions?
Yeah, lotions have it too.
Oh, I get so dry.
You know, it says here you can use water-based products. Just check the labels. Water-based products will work fine. And then about your little grandchild, do not change your flow rate without your physician's authorization.
Or turn it off. Turn it off.
So be careful.
Okay.
You're supposed to have a certain amount. I think your order was 2
2 liters.
2 liters.
2 liters.
Yeah, so
2
that's
liters.
what you want to be careful.
All the time.
And never use it for other things besides medical oxygen.
But what else would I use it for, honey?
Well, they just don't want you thinking about other ways to use it. Okay?
I've got enough going on.
Exactly. And then down here it says, watch out around the tubing, don't trip, keep your children and pets away. Okay? And by the way, do you have a fire escape plan?
No, I
Should
don't.
something
No, I
happen?
don't. I
Have a
don't.
kind of exit?
No.
Well, you have a front exit, which would be your front
and
door.
I got a back door.
That would be your fire escape exit.
And I have a door by my bathroom. Out of my
Okay.
bedroom.
Is there anything in front of the door that would maybe trip you if you had to leave in a hurry?
No.
Well, that would be your plan then.
No.
Okay.
So I got a front door.
And a back door.
I got a back door.
Perfect.
I got a bathroom, bedroom door.
Okay.
And then I got a door to the garage.
There you go.
I got
So
4
you
doors.
could escape if you needed to. With your cane handy.
4 doors. 4
Okay.
doors.
And don't
All
forget to
right.
call that fireman before you go.
Oh, honey. Oh, honey.
All
Yeah,
right.
yeah. We're gonna make sure. We're gonna
Okay.
make sure they know.
So I think we're doing fine, right?
Thank you.
Okay, Mrs. Dunn. Now I'm going to go do the next part of the evaluation.
Okay.
And I'll need to see your bathroom. Can you direct me so I can wash my hands and
It's
take a look
just
at
go
that
down
bathroom?
the hall and down that way.
All righty. Thank you
Okay.
so much. You take
Okay.
care now. I'll be right back.
Thank you. Thank you.
Hi, Mark. I'm Julie.
Hi.
I'm one of the nurses. I haven't met you yet, but I've come by. The doctor's wanted me to come by to draw some labs. I know the nurse was here yesterday, and she was, she drew them and she took the lab, and we got a call from Quest saying that there was a little bit of an issue with the blood draw, and so we need to repeat it, okay? So I just wanted to let you know that. That's why I'm here today. And I have another nurse who she's new, and she happens to be coming with me today. Her name is Karen.
Hi,
Hello.
how are you?
And she's just going to be watching the procedure of drawing labs.
Okay.
So,
I haven't been feeling well, so
no.
I've been feeling kind of down. So.
Oh, that's too bad. Is that just starch, or are you?
Yeah, I guess so. Since they did the when they drew the labs, I've just been
Feeling kind of sad, you mean, or just not feeling well?
just not
like
feeling
kind of,
well, I guess.
Yeah.
So.
Okay. Well, when do you have an appointment with your doctor? Are you going to see your doctor anytime soon?
Probably in a week or two.
Okay.
So,
So nothing,
somewhere around there.
nothing that, there's no scheduled appointment?
No, not yet.
Okay.
Not unless I really need one after today's thing. So, okay.
Okay. And how's your appetite? Are you eating well?
Yeah, I'm okay. I just had In and Out, so that was pretty good.
Okay. Well, that's,
Yeah.
somebody went and got that for you?
Yeah.
Okay.
That's good.
Okay. So what we're going to do is, I know the nurse was here and she changed the dressing on your pick yesterday, so it's just basically going to be drawing the labs, okay?
Okay.
Now, I've already washed my hands and sang happy birthday and all that, so it's
Okay.
so the hand washing's all done,
Uh-huh.
and so I'm just gonna come in and we'll get that
Okay.
taken care of, okay? And how's your wound doing? Is your wound doing any better?
I think it's okay.
I mean the wound on your foot?
Oh, my foot. No, that's fine.
That's
I'm
good.
with that. We stopped letting the dog lick my wound.
Oh, that's
after that, it healed up just fine.
good.
So,
That's always a good thing.
yeah. So,
And as far as that's a good time to talk about infection control.
yeah.
Yes, I understand that you've got I saw your little handout there that, the infectious
Oh, yeah.
control handout that you
Uh-huh.
were referring to, huh?
Yeah.
Good. Two of those.
I think it's
There you
right
go.
over here.
Yes.
So it's all right here. Something about my hands being clean and safe and all that stuff.
Good. Okay, so Cora and I'm going to be, I'm going to get an alcohol wipe and I'm just going to wipe. I'm going to wipe it like about 5 times.
That's a juicy alcohol wipe, right?
Mm-hmm. Yes, it is. And I'm going to let it dry.
That could take a while to let that dry.
Mm-hmm.
I
They don't want
guess.
you to blow on it, okay? So no helping it
Oh,
out.
I don't know.
Okay, now I'm going to take a 10 ml syringe and hook it onto the end of the cap, and I'm just going to draw back 5 milliliters. So let's do that. And I'm just going to disconnect,
I think I've dried up.
and I'm going to put that in the sharps container. Connect you. I'm going to draw back the labs that I need.
Must be running on empty there.
Yeah, I
huh?
don't. You have clear blood.
I guess so.
I'm gonna just- and then I'm going to get the little Christmas tree,
Yeah.
Oh, okay.
put it together. Take off the cap and connect that onto the lab tube. And if there's actually blood in that, that would actually vacuum into the tube. Okay, once I have that full, I'm going to throw that into the sharps as well. What I'm going to do now, Mark, is I'm going to just wipe the cap
Oh, okay.
again, and I'm just going to give it a flush.
Okay.
Try a little bit. This way I'm just going to get, there's a little bit of blood in the tubing, and we're just going
Okay.
to give it a flush with some saline. Give it a push pause. And then this other syringe I have that has saline in it, we're going to, I've got the air out of it, so I'm going to put it on the into the cap, and I'm going to just prime it a little bit to get the air out of the little bit of air that will be in the cap. I'm going to take off the cap.
Just in case I haven't been any dust there.
I'm going to take the cap off. Use a new wipe. Again for 5 good wipes. And let it dry.
It's kind of important to let it dry here. We just had somebody complain that the cap didn't come off, and they were wondering why, and we're deciding that when it's wet and you attach it, it seals it in and locks it like glue, so the next nurse can't get the thing off.
Well, they can't get it off.
Yeah.
Okay, I'm just going to...
Wow. Well, that wouldn't be good.
No.
No. Okay, and then I'm going to flush it with one more saline.
It's a lot of flushing.
It is a lot of saline, huh?
The bird's eye view of a lab draw can be broken down into a specific process, which a surveyor would definitely hone in on. Here's a view of how the specific process might look. All right, our focus for this piece is just to demonstrate a correct central line lab draw. Make sure we cover all the right points to make on that. First thing you need for any lab draw, obviously, is an order. So check and make sure you have the order. And the second thing you might need would be the gear. So for lab draw gear, don't forget the sharps container. If you don't have a patient that's an infusion patient, you will have to bring in your own sharps container from your car. We don't want staff to take syringes full of blood to their cars and drop them in the back seat. Laying around there would not be a good idea. And so make sure you have your sharps container. Your other piece of gear would be your biohazard lunchbox. Your biohazard bag, so that your labs can be toted correctly with in your plastic container, so that in case there's an accident, your stuff and their blood doesn't get all mixed up together. So that's kind of part of the gear to bring in. The other part of the gear is obviously the lab tubes that you will need and the flushes that are sufficient for what you need to draw. In this case, we will draw a tiger top and a PTINR. We'll need, for flushes, if you have TPN, you'll need 2 additional for a total of 20 mLs of flush per port. If you have TPN, you must first stop the TPN, disconnect the TPN, and then flush each port with 20 mLs of saline. So you could end up with a lot of flushes if you had TPN actually running when you arrived at the patient home. Other than TPN, just a regular lab draw, you would need 1 syringe for your discard. You would need 2 saline syringes for your follow-up flush. And if your line was not valved, you would also need your additional heparin. And you would also, of course, need your syringe for the actual lab draw. So what I like to do before I get started is set up my cap change. Every lab draw requires a cap change afterwards. So I go ahead and take my second saline flush and go ahead and attach my cap ahead of time, have it all flushed, ready to go.
Now, would you have washed your hands before that time?
Oh, I did when I started,
sorry.
yeah.
I was setting up stuff over here.
Yeah, so we started with clean hands, and we'll just flush that cap and get it ready. So when it comes time for the cap change, we'll be ready to go. All right?
Do I have a valve or a non-valved PICC line?
Ah, that's the question. So remember what you asked. The first thing you look for is it clamped or unclamped? And it is not clamped, so we know it's a valved catheter. And then you read the line to determine it is a Power PICC Solo. So that's how you can tell exactly what kind of line you're dealing with. Clamps or not clamps, and then read it. So that identifies your line, and so in this case, heparin would not be needed. If you find heparin in the home,
and you've identified it's a valve catheter, what are you supposed to do with that heparin? That's right, take it out, bring it to pharmacy. If you leave it in the house, somebody's going to be using it, so we don't want them to use it. Also, alert pharmacy that that line is a valve line, and they don't need to be sending heparin out on this patient anymore. Okay, so I always like to redo hand hygiene right before I put on the gloves, just in case touching the environment happened and contracted something from the table or something.
So we know each other, but if you were doing this for the first time, how would you identify me if you didn't know me?
Well, and what is your name?
Sharon Fredericks.
Alrighty, and then tell me your birthday that would match.
Not on film.
That would match.
Here, down here, I'll print it on my leg for you.
There you go. So those are the two patient identifiers.
Okay.
Now if I ask if their name is Sharon, that would not be good because...
I might be confused.
And she would love to be Sharon for the day, and that would send us on a wrong path. So,
it could.
Yeah. Okay, so we're getting ready to draw labs. So I want to identify this port. It's the red one for lab draws. I want to take a Juicy alcohol prep pad and cleanse that line at least 5 times. Make sure it dries completely, because the quote from Kurt is, Kurt's sheet on how to mix meds is, the antiseptic qualities of alcohol only occur upon drying. I'll never forget that one. Alright, so we have our 5 mLs of waste. So we're drawing back. There is blood in here. Clear blood, but blood nonetheless. And that 5 mLs of blood goes directly into your biohazard container. You don't want it laying around for the dog to get or to flush into the toilet or any of that. Just go straight in the biohazard, done. Then you have your syringe for drawing blood.
You know us vegetarians have different colored blood, don't you?
That's right. Clear.
You can't say.
Doesn't eat red meat. Perfectly clear blood. Alrighty. What I like to do is getting ready for the changeover. I like to have my saline ready.
Now what happens if I have Parkinson's and I start shaking here? It stays on pretty good, doesn't it? Okay.
So I'm going to put my Christmas tree in the one hand, get my saline ready, my saline flush, and have this ready to go for my first draw. Actually this one, because it's quantity determined. And I'm going to take my sample, place it here. Get my flush started. I don't have to worry about that anymore, and I can focus on putting my blood in the tubes. My line's already started to be flushed. When you're getting the labs ready, it's Quest prefers 8 turns on these most lab tubes to fully mix it. And this sharps goes straight into the sharps container. 8 times mixed, and then I can finish this flush, which I'm going to pretend because I don't want to get her all wet today. And then once that flush is finished, I can work on changing the cap. Cleanse the area here, the joint as it were, in case there's dust on there.
So how long does that usually take to dry?
Yeah, it seems to be taking longer and longer.
Can I go like this?
Probably not a good idea.
Why?
You want...
I'm only helpful.
Right. Apparently what they say is the air contains all kinds of things, so if you wave the air, those things could end up waving onto the moistened area, so they're frowning upon the flapping of the waving.
So what if I coughed on that right now?
That would be the worst thing.
Oh.
So if you do need to cough, you can turn your head
Okay.
And when you're doing PICC line dressings, nurses know to instruct the patient to look the other direction, which is not always effective. So if you have a patient that won't do what they're supposed to, you can actually put a mask on them. It's like put a bird on it. You just put a mask on it and then you're good. All right, so we are definitely dry now.
No, we're dry.
Yeah, we're dry. So I will get this ready. Take this off. Occasionally, it's helpful or necessary to clean this area. This looks perfectly clean. I'm not going to extra clean it. In the case of it being a little bit crusted over or something, it's okay to take a alcohol prep pad and clean that area first. This needs to completely dry before you put the new cap on, or else the moisture locks into the cap and then you end up with a cap that won't come off for the next clinician. That's just learned that last week. So perfectly dry, and then you're ready for your second flush, which you pause all the way down, and then your very last ml you unplug while you're flushing, and it should get just a little wet, which means you put positive pressure in that cap, which will keep it from clotting, keep blood cells from collecting on the tip. So preventative push pause and positive pressure flush at the end. I think that's it.
So would you label these, if you were in the home, would you label these in front of me?
Yes,
Okay.
mandatory.
Okay.
With patient name, date of birth, date, time, and my initials.
Okay.
5 items to label.
Okay.
With a Sharpie pen,
Oh,
because
the
a regular
Sharpie
pen
pen.
doesn't work.
Okay.
Want to make sure when after labeling the lab tubes correctly, you want to place them in that hazard-proof thick plastic container. And when you get to Quest Lab, they are going to wish that you are using their lab bags. There's a split in the lab bag. One section is for the paperwork. One section is for the tubes. They don't want the two mixed together. And they want the lab slip folded so that the code bar is on the outside, so they don't have to open this to scan that sample in. So these are some requests from Quest Lab to make their job easier and less hands-on for them touching these lab samples. Then when you are ready to pack it up, you would go ahead and pack it up and close your sharps box, and you would travel then with your lab sample box behind the driver's seat, so in case of an accident you're not being contaminated with what's in there. So never put this next to you on the seat, on the driver's seat. Joint Commission, State, they all want it behind.
In the back seat.
In the
on
back
floor.
seat, yeah. Okay?
All right. Thank you, Kim.
All right, so when drawing multiple labs, there's another device. It's called the BB Container Lure Lock Access Device for multiple lab draws. So when we're drawing labs using, say for TPN or a drug lab level where we need to draw multiple tubes, sometimes it's quicker and in the best interest of the nurse to use this device to get your lab samples. So you collect the sample the same way you did before. Clean the cap for the designated period of time with the juicing it well. Do this one. So you do the same cleaning technique here and letting it dry. And then once it's dry, you simply attach this end to the end of the cap, and you are now free to draw your labs. This does require a free-flowing line, so if your line is a bit sluggish, this won't work. You will then need to use the syringe and Christmas tree method of drawing multiple labs, but if that's not an issue, you can just fill one lab at a time and simply fill up that way. When you're finished, you would unhook this and then begin your flush procedure. Your first flush with your saline will clear the line, So as you complete your flush, your first flush, you would simply finish your first flush. You would unhook your syringe, and then your second flush would be ready to go with your primed cap. And you'd be ready then to change the cap as demonstrated earlier. Cleaning around the end, letting it dry, trying to unhook it. This is what we said before, if you can, if you get it wet and it's not, if it's wet when it goes on, that's a problem you have. So you want to be careful to make sure it's dry. If you clean in between, otherwise you have that problem where it locks in like cement and then the next nurse has a hard time getting that off. So that was exactly what we wanted to avoid the last time. Make sure this dries completely before you put the new cap on.
Can't believe that in the last nurse.
She has strong arms. No, it's that taping it. All right, and so then you can flush your second flush. And make sure you unhook the last flush so that it drips saline, and then you're set to go.
Okay. And I was going to look in your fridge and see how you, just take a look at how many antibiotics you have left, and we'll check that out if you're okay with that.
Maybe I can get
And
my
I'm gonna go
brother
over
to show you where the fridge is
Okay. Your brother's here?
somewhere.
Yes.
I don't know what my brother's name is.
Okay, those all check out pretty good. Hi,
Hi.
I'm Julie.
I'm Gabriel.
Hi, Gabriel. Nice to meet you.
Nice to meet you. How's old Mark holding up?
He's holding up pretty good. He's
Old Mark.
He carries enough gray for both of us.
I see. You get along well, do you?
Yeah.
Oh, yeah.
That's good.
A lot of years.
So what? A lot of years. You go back being
We
brothers
go
a lot
back
of
a
years.
long
I see. Yes, that's usually the way it is with
Yeah.
brothers.
Yes.
We
So-
shared a room for a long time.
I see.
Yeah.
Okay. And I see a whole bunch of new medication over here.
Yes, yes.
We have a smorgasbord of medications.
Smorgasbord of medications, and I'll have to look. You know, maybe it would be a good idea right now if I go on my computer and we can go through all that to see what's
Okay.
new, and we'll just go over your medications.
good.
Okay.
Okay.
That'll work. Great. It'll work. I was just going to show you, Karen, how to pull up on the computer where to
Okay.
document the labs.
Okay.
You go into the problems, and here's the order here that we have to draw today. It's a CBC and a CMP,
Oh, okay.
okay? And
You better take
so you always want to make sure that you've got the order, and then you can, then after that you just would document in the problems that you did indeed draw them, and then document in the clinical note that what you did and drew it from the PIC line and so forth, and that the labs went to Quest, and
Okay.
in the clinical note, okay? Okay, Mark, your nurse is going to be back next week to change the dressing on your PIC line and to change the dressing on your foot. So the labs are going to go to Quest, and if you have any questions, call. If you have any concerns, give us a call. You know how to get a hold of us, right?
Yeah. I think I have your number.
Good. You have it in the folder?
Yeah.
Good.
Somewhere around
He likes to call often, not a problem.
there. I like to call. I'm
You know the
lonely.
number by heart, huh?
Lonely, I like to just call and talk to people. So.
Okay. Okay.
All right.
Well, it was nice to meet you.
It's nice to meet you.
And take care.
All right. Thank you.
Okay.
Thank you.
Thank you, brother.
Thank you.